All right, the Quadratus Lumborum, I would say, is one of the most misdiagnosed things going around when it comes to low back pain and referred pain into the leg. So obviously when you have referred pain into the leg, we suspect neural involvement, but the QL, according to Travell and Simmons and a lifetime of treating patients, is another one that can drift on and go down into the hamstring. So the QL is kind of a broad sheet-like muscle that's reasonably deep. It has a couple layers and a different set of fascial layers. So it basically attaches the bottom of the ribs to the top of the pelvis in lay terms. How we palpate it, it's a lot easier to palpate it inside lying and getting them to open up that region of their back. But I don't like to needle in that fashion because there's too many elements that can move. So I like them to be completely relaxed and comfortable. So the QL, we drift in, we're going to feel with our fingers where the erector group kind of drops off. And as soon as it drops off, we get into this little cavity and we can press in towards their lungs, and they will tell you that they feel pain down here near the SIJ or the top of the pelvis. And if you go a little bit further down, they can sometimes tell you that they'll feel their referred pain heading off. Now, there's a couple things there. Are we just putting pressure on the nerves? I don't know. But what I can tell you is when we specifically needle or release that with massage, that referred pain can reduce significantly. Their flexion range and extension range can improve out of sight. You also get changes in actual motor patterning. So when they extend, they tend to extend uniformly rather than just by one segment. So we look at where the erector group is, we drop off into the kind of the cavity, we feel that trigger point, and that is where we're going to be needling it. So there's two for the QL, there's one there and there's one a little bit further down. Now, you can get yourself into a world of hurt because we're down right in the basal part of the lungs. If you are using a needle and heading it up towards underneath the rib cage, you are going to have some sort of penetration, through the diaphragm. Now you might cause that diaphragm to spasm. They could go into panic mode. Have heard in the past that a patient panicked when getting a very low needle because of the amount of nerves that they can activate, and when they panicked they caused themselves a spontaneous pneumothorax and they were rushed off to hospital. So these things are serious. When you're needling in and around the lumbar spine, just make sure that you're trained proficiently, that you're under supervision, and that you're working with someone who knows what they're doing. So we drop it off, we pop the needle onto their skin, large whack, separate the skin, and we're going to be inserting it towards the spine. Now we don't want huge amounts of jumping here. This is not what the QL's about. The QL's about finding the referred pain that the patient is describing rather than spasms. You've got to remember, with these injuries that they've got of their back, the spasms is what they're wanting to avoid. So I find, as far as patient comfort is concerned, don't go for the spasm, go for the comfort, just bring on that pain and let the needle stick there. All right, second needle point. Same thing, you drop off the erector group. This one's a little bit more difficult to find. Same thing, we have it towards the spine, so we're going lateral to medial. Depending on the development of the erector group, depends on how easy the QL is to find. On some people whose erector group is really, really ropey, you just drop off it and then bang, that sheet of QL is just sitting there ready for you to stab. But that is a QL needle. It is an advanced technique. Be gentle with it. Try to bring on the referred pain of the top of the pelvis and into the hamstring. Go easy, be supervised. That's the 411. Thank you, Dan.